Two surgical philosophies or approaches are usually employed in the surgical management of rectal endometriosis. The radical philosophy, mainly based on colorectal resection, and the conservative philosophy or symptom-guided approach, prioritizing conservation of the rectum by rectal shaving or full-thickness disc excision. Due to the poverty of comparative studies, recommendations concerning surgical management of colorectal endometriosis are based on little evidence and tend to reflect the personal convictions and experience of those experts editing the guidelines. The aim of our retrospective before and after study was to compare delayed digestive outcomes in women managed for rectal endometriosis during 2 consecutive periods of time. During the first period, we employed the radical approach and we did perform the colorectal resection in 67% of patients, while during the second period, we adopted a symptom-guided approach and we reduced our colorectal resection rate more than threefold. We estimated the postoperative digestive function using standardized gastrointestinal questionnaires. We clearly observed that all the parameters were generally improved in women benefiting from the conservative approach, suggesting that conservation of the rectum enhances delayed digestive function. Even though significant improvement in quality of life is achieved for a large majority of patients undergoing colorectal resection, the key question is whether a greater level of health improvement can be achieved by performing rectal shaving or noodle excision. In our opinion, a 10 to 20% of colorectal resection rate would bear witness to surgical wisdom and prudence, while performing mandatory colorectal resection in all women referred for rectal endometriosis appears both excessive and insufficiently supported by evidence data. A more definitive answer should be provided, however, by a randomized trial comparing colorectal resection to conservative surgery and deep endometriosis infiltrating the rectum. Such a trial is ongoing in our department, and its full report is planned for 2015. It is expected to provide further and key answers to the long debate between defenders and opponents of mandatory colorectal resection in rectal endometriosis.